Hi everyone, I'm Shoaib Ahmed, PCN pharmacist and host of this podcast. I'm pleased to welcome you to our Seacroft Primary Care Network podcast. It's a chance for you to meet the people involved in your care and to have an insight into how practices work together to create the network. Today we're meeting Dr. Cat McNicol, who's a GP partner at Park Edge Practice, and today we're going to be discussing accessing your general practice team and how to make the most out of your appointments. Welcome to the podcast, Cat.
Thanks so much. Thanks, Shoaib.
Thank you.
Glad to be here.
Okay. So, first question is just how can patients access primary care services?
Yeah, I think this is such an interesting question, isn't it? Because it's definitely changing. People used to very much think that one of two things: you'd either pop in, book an appointment, or you'd phone and you'd get an appointment. I'm sure everybody out there recognises the huge demand and pressure that general practice is under, and therefore we are thinking of different ways to try and encourage people to access us, so that people can find it easier to access us in a way that works for them, but also in a way that helps us speak to the most number of patients in the most efficient and safe way. So there's still, if you read all the news, and actually many of your patients will have experienced it anyway, there is still an 8 a.m. rush. So people are desperately trying to get to number one in the queue at 8 a.m. on the phone, or they might even queue out of the door to try and come in and get an appointment. And that's far from ideal. And what we want to try and get is away from that need to have such a rush at the beginning of the working day. So there are different options now available for accessing your primary care team, your general practice team. You can, and it will be very much practice dependent. So you need to make sure that you do understand the means of your own practice. Within Seacroft PCN, we do work together as a team across 4 practices, but we are still individual practices, and everyone will have slightly different ways that they do things. So reflecting onto us here at Park Edge Practice, we offer a number of different ways. You can still use the phone line and call up. If you want to phone to make an appointment, there's every chance that you will be waiting in a queue, but you'll move through that queue when you then speak to one of our care navigation team. At this point, the care navigation team are trained to ask a series of questions to try and drill down into what's really important in the thing that you're worried about that day. How urgently do you need to see someone? What's the nature of the problem? And actually, is it a GP you need to see, or would you benefit from seeing one of the wider members of the primary care team, which we'll probably come back to later? So there is a phone call, but you're going to be in a queue, and the more people who try to phone, the busier the line will get. So the other option is, and for a lot of people this does work, is you can access your practices online now, and it's just it's an equally viable way to do so. There's no preference given to one mean or the other. So if you go onto our website at Park Edge Practice, just like if you go onto the website of your own practice, you will find an either access your doctor online, or access the team online, or online consultation, or a button that perhaps says e-consultation, electronic consultation. At that point, you can click onto the system. You might need to register with it for the first time that you do it. And then you will then be asked a series of questions in relation to your concern or your worry. Now, that might be something clinical. So you might have a physical or mental health problem that you want to talk about, or you might actually want to talk about something more administrative, so a medication request, or perhaps a sick note or something like that. And there are 2 different pathways for that. So there's a clinical pathway and there's a non-clinical or administrative pathway. You can fill out the details, that will come through to a doctor and we'll triage it. And that means you don't have to sit on the phone, and you can use the online tool. So using online tools are a nice, efficient way. You can do it from your mobile phone. You can do it when they open up in the morning, and you know a doctor's going to look at it. Or you can continue to use the phone to try and access that way. Or some people do still come down to the practice, which is perfectly reasonable. So those are your main 3 different ways that you might access some care through your general practitioner.
So you mentioned care navigation, and some care navigation has become more important over the last couple of years.
Yeah.
In your eyes, what is the purpose of care navigation?
Yeah, so care navigation is a really important part of the patient journey. And actually, interestingly, it's something that patients still get a bit upset about. it's not uncommon to hear people saying, the receptionist was asking me questions about my health. What does it matter to her or him?
Yeah.
But actually, all of our care navigation team are trained when they come in to ask you certain questions, because we've got to identify, with your help and with our clinical understanding, what the problem potentially is, how urgently it needs to be dealt with, and who is the best clinician to help. So by using care navigation, we can decide, actually, do you know what? Yeah, this person does need to see a GP, and it needs to probably be within the next 48 hours. Or we might say, actually, this person would really benefit from seeing a physiotherapist as opposed to a GP. And what we can do is get them booked in straight away with a physiotherapist. Likewise, this person might benefit from talking to a clinical pharmacist. So the nature of care navigation is really important. We would love it if people engaged and talked with their staff about their problems so that we can get them to the right clinician in the right time.
Thank you. And obviously, with the kind of ever since COVID, there's been an increasing use of phone and online consultations. How do you think these methods benefit some patients, and what should patients expect during these consultations?
Yeah. So electronic consultations, like you said, I mean, we don't tend to do video consultations. It is an option, but it was there, and we did a lot more of it during COVID because everything got flipped on its head overnight, didn't it? So we were trying to find new ways of making sure we could still see patients, even though we were being told we shouldn't see them up close. So that is an option, but electronic consultation or e-consults or online consults are a really useful tool. We recognise that online communication is really difficult for some people, and it's not appropriate for people who don't know how to use smartphones or computers, and that would put them at a disadvantage if we only used that as a means of communication. But for a really large number of our population, using tools such as a smartphone, tablet or a computer means that they have ready access to clicking on the online button. During that process, you'll get led through a series of clinical questions based on how the thing that you're presenting with, what is the problem or what is your worry. It will ask a series of questions, and that therefore helps us identify within that clinical tool, again, the urgency of the appointment. So when you complete an e-consult, it comes through to a clinician. In Park Edge practice, that's a GP, but in some other practices, it may be an advanced clinical practitioner as well. These are practitioners who have a significant experience in healthcare, normally either pharmacy, speech and language, dietetics, something like that, who've gone on to do further study to then become clinical and actually deal with patients. But a clinician will look at that information and triage it, which means we can get the information from that we need to then say, okay, I recognise that Mrs. X has this problem, this is what she's worried about, and actually I do agree I should ask her to come down and see me. Or Mrs. X has this problem, it's been going on for 2 years, I know she's at a point now where she wants to come in or wants to speak to one of us, but we could probably make this a routine appointment and give her a call in a couple of weeks to tee it up. So it's a means of patients communicating what's happening. It allows us to triage the information and then allows us to get them the right appointment with the right clinician.
So it seems like it's more of a streamlined system. It's more efficient for this day and age.
It's just, it streamlines the process. It takes it away from sitting in a queue on a phone. It's very easily accessible if you're in a position, before you go to work, you're having your morning coffee, you think, look, actually, this is the time that I'm worried about that lump, or this breathlessness just not going away. I am going to contact the GP. So it gives the patients flexibility to contact us when they feel like they want to, and it takes out that kind of, which we know can be frustrating for patient, that waiting on the line number 8 in the queue. Do
you find this helped patients improve access to the services now as well?
I think so. I think it does. I think we've all got to understand more about it because it is still relatively new. It's been there before COVID for many practices, but we're now utilising it a lot more. And actually, it has improved access. But what I think we've really got to do is fine-tune it and say, look, actually, if we can get more people using the online communication and free up the phone for those people who are not internet literate or who would struggle with that form of communication. So let's free up and keep one method of access for them and support them. But the others, if we can understand more about how people want to use it and how frequently, then we could open it up a lot more and actually start using it to really push through the number of appointments so that more people can access it in a more timely fashion.
So we've gone through care navigation and we've gone through kind of the types of consultation. So once the patient's been booked in for the care for consultation or face-to-face, once they're in that consultation, is there any top tips for getting the best out of that consultation?
Yeah, I think definitely. I think one thing we recognise as GPs is that I know that you've made mention there, haven't you, Shoaib, to the consultation, the 10 minutes. You come along, you get your 10 minutes with the GP and it's the consultation.
Yeah.
What we know as GPs, but we're all, humans, we have been patients ourselves, we have family who are patients. What we know is that the consultation doesn't start the minute you walk into the room or we start talking.
Yeah.
The problem for you as the patient starts when you start thinking about it, when you're worried about it, and you start thinking, do you know, I probably do need to speak to a doctor about this, or a pharmacist, or whoever it is that is the right one.
That's true.
So that worry that the grumbling thoughts in your head, or the bump or the pain that you're worried about, that's the start of the consultation for the patient. And the best thing that you can do is, if you know you're going to speak to try and access health advice or health support from somebody in primary care, is really think about what it is you want to explain at that care navigation point. So how new is your problem? How worried are you? How long has it been going on for? Who do you think would be the best person to see? Now, interestingly, most people would still say a GP, and that's the case for many things. But if you come in with a kind of preconceived idea of what help you think you might need, it helps the care navigators get you to the right place.
Yeah, that's a good point.
And then when you come in to see a doctor, a pharmacist, or a physio, what's really helpful for us is to understand what you're worried about. Why are you worried about it? And sometimes when you come in to see us, even though I try to be very supportive, friendly, and as relaxed as I can be, it can be really nerve-wracking when you're so worried and suddenly you're in the room and you've got 10 minutes and am I going to get it all out? So I really like it when a patient comes in and they've actually written something down, because they know they're going to get flummoxed, they know they might get a bit worried and they might miss something. So when somebody says to me, look, this is why I'm here today, this is why I'm worried, and I've written down what's been going on so I don't miss anything, I say, fantastic, talk me through it all, and we can look at the list together. So I think having an idea of what it is that's worrying you, why you're worried, and perhaps writing things down helps you frame it. I think when you're in the consultation with your GP will then ask you some more targeted questions, and you might think, hang on a minute, that's not really what I thought I came in about. And to some extent, that's because when you come to see a GP, you've got a thought process and an agenda that you want to come in and talk about, but you might say a few things that trigger your GP to think, hang on a minute, why did she mention she's getting chest pain when she's exerting herself? I know she was worried about her mental health, but I think I also really need to ask her about her chest pain. So sometimes it might go in a slightly different direction. So be prepared for those sorts of questions. And then I think really at the end of it is, we have a lot to cover in 10 minutes, getting you into the room, talking to you, examining you, or if we're on the phone, looking at your hospital records, checking other blood results. And it can be very difficult, but it can also be very unsafe, and mistakes can be made if after 8 minutes, 9 minutes, you drop in another problem. So we really ask you to come in, and at the beginning, if you think you have a couple of problems, say that at the beginning. I really want to talk about my mental health, but actually I'm getting foot pain as well. And we can say to you, right, we might be able to cover both of them today, or actually, do you know what, we can only really talk about mental health. So why don't you rebook for the foot pain? And what it avoids is missing something, having a mistake, but also it stops us from running late, impacting on all the next patients, and then you get stressed GPs, stressed patients, and a less efficient environment for really good, safe medical practice.
There's some great tips. I mean, I've definitely found when patients come prepared, it just definitely makes things a lot smoother and easier. So
I think particularly in your case, when you're thinking about obviously clinical pharmacy and reviewing medications and so on, having medications ready for that is really sensible.
There's some great tips. I'll put a summary in the description of the video below. just before we finish the podcast, is there just one tip that you recommend to patients if they had to take one thing away from this episode? What's one tip that you would recommend?
I don't even know if it's a tip. I think it's probably just a bit of knowledge, which is general practice, whether we like it or not, is changing.
Yeah.
It is moving away from the accessible family GP to a really very busy, high demand service where we're trying to meet demand. It's very, very difficult.
Yeah.
And the way that it's happening is that there's lots of other people involved in primary care now, lots of different roles. And we would ask you to trust the system, that when we're asking you questions and trying to find out what's worrying you, what's bothering you, that we will try and get you to the right person at the right time. It won't always be a GP, but it'll be a really good, reliable team member who will also offer you something. And trust us that we'll keep looking after you if you just invest in us and know that we're trying our best.
That's great. Thank you for that. That was very informative and a lot of great advice there. Thank you for attending this podcast. For everybody who's watched the podcast and found it interesting, please like and share because it'll help us grow and get the message out in the podcast. But thanks a lot for joining me, Kat, and I look forward to seeing you next time.
No problem.
Thank you.
Thank you very much.
Bye-bye.
All right then. All the best. Bye.